Welcome. It is Friday, April 25th. This is House Healthcare. This morning, we're just gonna go over section 7. Jen's not here to do a walkthrough, but it's literally a paragraph, so I think everybody can walk through it themselves. And first up, we've got Mary Block. Sorry, I can't see very well. I wanted to make sure it wasn't black. From DFR.
Block, Director of Insurance Regulation for the Department of Financial Regulation. I really need a shorter title. So the department has no issues with the language that's in section 7. We honestly don't believe it's needed for us. We already have this authority, so we have the ability to look at any contracts for our regulated entities as it is. But don't see any harm in adding it either. We do know that some of the contracting entities have some concerns about the language that's been struck, the confidentiality language. We also don't have any concerns with adding that back in. That confidentiality, those confidentiality agreements do not exclude us, so we would still have the ability to look at the contracts if they had confidential agreements. They're not allowed to exclude their regulators. We would not object if after hearing from them, you decided to add that back in, and we are fine with the language as it is with respect to our ability to get copies of the agreements.
Right. I just I don't know if anyone else has a question. So does DFR have the authority for any regulated insurance or payer, I would assume we're talking about here? Can you see all their contracts, or are these just contracts between, say, payers and hospitals, payers and providers? Or I'm thinking about things like their third party vendors that sometimes they use.
So we do have the authority to ask for those because, well, at least for Blue Cross in particular, because they are a domestic insurer and we are responsible for their solvency. And so we ask for contracts sometimes in the context of looking at financial obligations of the companies. We have asked for them from non-domestic insurers in various circumstances. When we've been doing some type of targeted examination that they're related to. It's not something we do on a regular basis, but if it is directly related to something that we're examining or investigating, then yes, we have the authority to ask for those contracts.
And that would include Cigna, who's with us today?
Yes.
Okay. All right, so you have no problems with adding in language, and you have no problems adding back in the privacy confidentiality piece. Okay. Well, thank you.
You're welcome.
And did anyone have any questions?
One question.
Go ahead.
This is a question for you, but maybe more for you, is I'm wondering why this was included at all.
I have to be honest with you, I'm not quite sure. Maybe Mary has some
Actually, I
insight.
heard a comment yesterday in Senate Health and Welfare. We were there on 482. And Senator Lyons did make a comment that she had heard at some point, I think from Deputy Commissioner Brown. She asked a question about whether we looked at these contracts, and I think Deputy Commissioner Brown said no, because it's not something that we normally do. We only do it if there's a reason for us to do it. And we haven't looked at provider contracts for Blue Cross, for example, for probably 4 or 5 years, but we did look at some at one point because there was a question that came up. But I think she may have put it in there because when Deputy Commissioner Brown said no, she possibly thought that we didn't have the ability to look at them, not simply that we hadn't looked at them. So that may be where
So
this
just
came
the
from.
simplicity of this bill, if we don't need it.
You might want to hear from the Care Board because I'm not sure if their ability to access them is limited to the scope of a rate making decision. So this would obviously be broader than that, and you'd want their take on that.
So currently DFR has this authority, but we're not sure if the Green Mountain Care Board has this authority.
I would expect they probably do in the context of a rate decision, but I'm not sure if they do broadly. So,
All right,
That's helpful. Thank you.
thank you. I think next we're gonna hear from Christine. Hi,
Good
Christine.
morning. Good morning. Can you see and hear me okay?
We can.
Thank you very much for this invitation to provide a few comments on Section 7. Again, I'm Christine Cooney. I'm the State Government Affairs Manager for Cigna. I cover all the New England states. Thank you again, Chairwoman Black and the committee members. We understand the goal of the legislation. So quickly first, I just wanted to say, thank you. I understand that we're looking and the committee is looking, really broadly to see what can we do legislatively that would help Vermont residents, employers, as we're looking at this, struggling, I guess, with rising healthcare costs. So totally appreciate all the work that's being done and the broader intent behind the bill. Just real quick as a reminder, we're a global health services company. And although the majority of our plans in Vermont are self-insured, we do support over 3,000 fully insured commercial members in Vermont. So just wanted to remind folks, our mission is to improve the health and vitality for everybody that we serve. That includes the health plan members, the businesses that we contract with, we do plans for, the families, and certainly the community at large. So it was actually helpful hearing DFR go first. So thank you for doing that. Section 7, this change really would restrict the confidentiality agreement. So, in talking with my contracting lead and our attorneys, we do have some concerns, and it's all around the confidentiality. So I understand, that our regulator already has the authority, and certainly we can appreciate and understand why they might want to look at contracts, but without those confidentiality provisions, we're just really concerned about the impact that could have, the unintended impact that could have of probably even driving up prices because you are threatening, the competitiveness between carriers by if that information were to somehow get out. And I would also just point to the federal requirements where we are already, the providers and the plans are already required to post a lot of public information through the machine readable files that's really tied to the rates. But that's a little bit different than what's in the contracts. The contract information we consider competitively sensitive. So if it's disclosed publicly, it could just really impact the competitiveness and have that unintended consequence of driving up prices. So we appreciate DFR's comments about the confidentiality piece. That's kind of where the crux of the issue is for us. We certainly would love to see that language back in if this were to move forward. I think the other thing for us was just trying to understand the purpose of the review and what it would be used for beyond the authority that the department already has or that the Green Mountain Care Board already has. Certainly interested in hearing about the confidentiality provisions that already exist with the Green Mountain Care Board. So as you are learning that, I will be happy to learn that as well. So I don't know if you have questions for me on our position, but certainly a concern all around the confidentiality, I think would be our biggest piece there. And I also, if you have a moment, just wanted to mention a couple thoughts on Section 10, but if it's not appropriate right now, I can send that to you separately.
Happy to hear your thoughts on Section 10.
Okay, I will be super quick. And that was really the piece about the integrated data. And again, totally understand some of the intent and the support for that provision. Do have some concerns very similarly, and to save you some time, I'll say, I can align my comments with those that Blue Cross made. I believe it was yesterday. We have a lot of the same concerns. A lot of our data is for self-insured plans, and a lot of those employers do not choose to opt in to having some of their data shared. So it's not necessarily a full set of data that you're looking at. I do get concerned about duplication of efforts. We do report data to our regulator, DFR. We do report data to the all payer claims database already. So just being careful to not administratively duplicate efforts in that provision. And so again, to save time, a lot of the same concerns that Blue Cross expressed, we would align ourselves with there. But happy to answer any questions that you might have.
Topper has a question.
Are you part of a group that's, believe is setting up some consensus language to protect privacy?
Could you just ask that one more time? Is Cigna part of a group?
A group of people that are setting up some consensus. I'm getting this here now over here. Does that mean they're not part of it?
I'm not part of it.
It doesn't sound familiar to me, but I think Becky Lewandowski's in the room, who's our on the ground lobbyist, and she can certainly follow up with you.
Yes,
Thank you.
I don't believe so. I think the consensus language was AHS, Office of the ACA, and the Green Mountain Care Board.
Yeah. And it came through this morning.
Yes.
Hey,
Yes.
what?
We got it this
Yeah,
morning.
Oh, I didn't see it.
Yeah, I don't believe we're part of that.
Right. Although I do believe that in the language that I saw, I believe that the little C was struck. I did note that. So that might address your concerns, possibly. I actually have just a question, because frankly, it's been a constituent issue for me this year. Does DFR currently have the ability to see your contract, Cigna's contract with ASH? I'm gonna call them ASH, I guess. Regarding your utilization management contract with ASH regarding OT, PT, and acupuncture. Are they allowed to see that contract?
I would defer to DFR just because I don't know off the top of my head. I could certainly find out.
I would say yes.
Okay. All right. So I would suppose if DFR was investigating something or looking into something, they would be able to acquire
Yeah, if
that.
we felt the need, we would be able to ask that.
Okay. Topper, did you have another
No,
question?
I was just wanted to recognize
Okay.
that she wanted to say something.
Any questions for Christine? Okay. Well, thank you. Thanks for making the time to be with us today.
Thank you very much. Appreciate your time this morning.
Hi, Sarah. Come on up.
Again. My concerns echo those of Cigna. It's the crossed out language that eliminates a contracting entity from requiring a reasonable confidentiality agreement between the provider and the contracting entity. So that's language we'd like to see retained in current law. We believe that the Department of Financial Regulation already has broad authority to view all of our contracts. Echoing what Mary said, they don't ask for them all the time, but we certainly have provided them anytime they have asked. And for the Green Mountain Care Board, I think that they are limited to things that are in the context of a rate hearing. So when they're reviewing our rates, that's generally when they ask for things. I will tell you that the Green Mountain Care Board asks us for information all year round, and we provide it to them. So if they were to ask for these types of provisions, I think we would anyway. So we have no problem with you putting it in statute.
I'm sorry, go ahead, Woody.
Is there any information that you never provide to the Green Mountain Care Board?
I can't think of anything. I mean, they really do have very broad oversight. I maybe if it was in the context of something they don't oversee. Do you know what I mean? Like I'm thinking Medicare, maybe, because there's no state oversight over our Medicare lines of business, really. Might be one area that we probably wouldn't share. And
But DFR does.
DFR has limited oversight, pretty limited. on
We have
that.
limited oversight over Medicare, but we have full financial oversight
Yeah.
over Blue Cross. We don't have full financial oversight over Cigna, so that would be a different conversation there. But we have, we have oversight over anything they're selling here, and any contract that is related to anything that is, any business that's occurring in Vermont.
Even Cigna's Medicare Advantage.
Are they still selling it in Vermont? They're not selling it in Vermont.
They're supplemental. I
If
believe,
it was heads up, then yes, we would have some oversight over that.
okay. Any questions for Sarah? Thank you. Thank you. I know I saw Devin in the building here today, but I guess we'll go off of that.